Thank you for joining me today. In this video, we are going to learn more about the psychiatric clinical reasoning framework. You want to assess the safety before you evaluate the diagnosis. You want to assess the suicidal ideation, if the patient has a suicidal thoughts, if they have a meaning, intent, plan, access to lethal women, if they have previously attempted, if they have a protective factors. You want to assess the high risk features such as a specific lethal plan, intended to act, previous serious attempt, psychosis if they are in psychosis, if they are taking substance and they are in a substance intoxication, if they have any major loss and they are in grief. You want to also assess the violent risk, if they are homicidal, if they are common hallucination, history of violence, if they are using substance, if they are impulsive. And second, you want to determine the symptoms. You want to ask yourself what psychiatric symptoms is present. If they are having depression mood and sadness, the syndrome will be depression, major depression syndrome. If they are having a manic episode, you want to assess the mood elevation, decreased sleep, grandiolous. If they are in a psychosis, you want to assess hallucination, delusion, disorganized status and behavior. If they are anxious, you want to assess the excess worry, tension. If they are in a neurocognitive decline, you want to assess the memory decline, impaired function. If they are having a ADHD, you want to assess the symptoms of inattentive with hyperactivation. And then next, you want to rule out if there is any medical causes for this symptoms, and you want to assess if this is endocrine, and then if they have any depression symptoms, or if they are fatigued, or if they have cognitive slow, you want to assess if they have a hypothyroidism. You want to check the lab and evaluate the lab of TSH and free thyroid. And then if they are having anxiety, manic, or sleep disturbance, insomnia, you want to assess the hyperthyroidism. If they have a neurological disorders, you want to assess the dementia, you want to assess seizure disorders, you want to assess the brain tumor, brain injury. If they have alcohol induced disorders, you want to assess what kind of, if they have a substance induced disorder, you want to assess the alcohol, cannabis, stimulant, opioid, sedatives, hallucinogenics. You want to assess those. If they have, and then you want to choose the treatment. You want to choose the treatment based on the symptoms of the patient. you want to see first, you want to choose the psychotherapy. Psychotherapy is the first line of treatment of mental health disorders. For example, cognitive behavior therapy, didactic behavior therapy, and exposure therapy, and then medication will be the second choice. And based on the diagnosis, you select the medication based on diagnosis, symptom profile, safety concerns, patient preference, comorbidity of the patient, and then you want to combine the treatment with the therapy, combine the medication with the psychotherapy. Often a combination will help if the patient have a severe depression, if they are bipolar, if they are psychosis. It helps the diagnosis before medication. You want to also rule out, do not just choose the medication until the diagnosis is clear. If the patient is presenting depression, you want to ask the question of what medication should I start with, or what medication I should prescribe first. You want to first determine, is this a major depression? Is this a bipolar depression? Is this substance-induced depression? If this is depression due to medical illness, you want to rule out this. Then you want to give anti-depression medication. You want to also know if they are manic. You don't want to give anti-depression medication if they are manic. Rapid cycling, increase the mood, unstable. You want to rule out all that. Then you want to assess if the medication you are choosing is best fit for the patient preference, patient scenario. Thank you for joining me. Please subscribe and join me again.